Sciatic nerve pain during pregnancy can be a very debilitating condition. In our office, we also provide chiropractic pregnancy care. And one of the most common pain conditions I see in our pregnant patients is sciatic nerve pain during pregnancy. For a mom-to-be, all she wants is a stress-free, pain-free, wonderful pregnancy and birthing experience. However, sciatica during pregnancy may make the pregnancy experience feel longer and definitely more uncomfortable. Hello everyone, I'm Dr. Walter Salubro. I'm a chiropractor in Vaughan. Welcome to this video. In this video, I am collaborating with another chiropractor. His name is Dr. Peter Angiarelli from Burlington, Ontario. The purpose of this video is to give you 2 tips to help with sciatica pain relief during pregnancy. And Dr. Pete will share these 2 tips with you and even demonstrate it with one of his patients. So let me turn it over to Dr. Pete right now.
Hey, I'm Dr. Pete Angiarelli from Burlington, Ontario, and today I'm going to be sharing some tips to help you if you're suffering with sciatic pain during pregnancy. So if we're going to talk about sciatica, first let's understand what it actually is. And sciatica is usually referring to inflammation or irritation of the sciatic nerve, which is formed in the lower back and the pelvis. And so when people talk about having sciatica, usually what they mean is they're having pain from the lower back down into the glute region or the back of the thigh or down into the leg. Now, there are many possible causes for sciatica, and certainly the causes may be a little bit different in pregnancy, but some common causes of sciatica are things like disc herniation or disc irritation of the sciatic nerve, and there may be other things that cause pain to go down the leg that are not actually coming from the sciatic nerve, such as irritation of the sacroiliac joint in the lower back and pelvis. When it comes to sciatica during pregnancy, especially in the first and second trimesters, usually what we're dealing with is abnormal movement and alignment of the lower back, sacroiliac joints and pelvis, and also tightness or irritation of the muscles in that region. Getting into the third trimester, you can get sciatica from actually the positioning of the fetus, but that we'll talk about on a different video. So let's go into some of the things that we can do if you're suffering from lower back pain or pain that's radiating down into the gluteal, back of the thigh or leg during pregnancy. So now we're here with a patient, and Alexis, you're in your second trimester right now, and you started with some lower back pain and pain going down into the leg about a month ago. So why don't you tell our viewers what was happening?
So I first noticed that I was feeling sort of an uncomfortable pain in my lower back, and then really feeling it in the glute area, and then it was going down the leg as well. I couldn't really decide if it was related to an exercise I was doing or just standing, but it was very uncomfortable, and I thought I better tell you right away.
Right. So when we checked you down there, do you remember there was an area that, and Alexis had been a patient coming for chiropractic care before you were pregnant, which is always really the best scenario, so that your spine and movement and alignment is better before you actually start growing a baby. But do you remember there was something that we noticed in you that we found that was really contributing to the problem? Do you remember what that was when I checked you?
I think it was to do with the tightness in my glutes.
Exactly. So there's a muscle called the gluteus medius, which we're going to show a demo of in a little bit. But that muscle can actually, if in people with pregnancy or not, if that muscle is really tight, has trigger points, and is even weak, we can get lower back pain and pain starting to go down into the leg, which sort of looks like a sciatica type problem. So we did some work on those muscles in the office along with your adjustment, and we sent you home with some stretches. So how long did it take for the low back and the sciatica to improve?
I'd say I'd actually started noticing a difference within the first few days. And then the more I was stretching and the more I was coming to get checked and treated, then I could last longer between those times of feeling that pain, which was really exciting.
Great. And I think the goal here is to have you be able to go through your pregnancy feeling good, still being able to be active and functional, right? Cool, great. Okay, so next we're going to go into some of the techniques and stretches that we've been using. Okay, so now we're going to show you guys some of the things that you can look for to get relief from sciatic pain during pregnancy. So I'm going to show you that gluteus medius trigger point that I've been doing with my patient Alexis, that has given her a lot of relief from low back pain and sciatica during her second trimester. So can we get you lying on your side facing me, Alexis? So your head will go there. So this is a technique that I do when Alexis is in for her regular checkup in the office. So the glute medius is a muscle that comes from the pelvis and inserts over onto the lateral part of the hip. So you can locate it when we find our patient's sacroiliac joint, and we just kind of trace an area like that, that's where we'll be looking for the trigger point. And so you can use your thumb. As a practitioner, I like to use my elbow to get a good amount of pressure in there. And I just kind of feel around for a tight area, which in this case is right here. And I'll just hold on that spot. It's a little bit uncomfortable, right?
Yes.
Yeah. So it's gonna hurt a little bit as we get onto a really tight area of the muscle, but I'll hold that spot for around 30, 45 seconds until I feel it let go. And then usually I'll follow that with, if it's indicated for the patient, an adjustment of the sacroiliac joint on that side, along with checking the rest of the patient. But that will restore the function of the pelvic joints and muscles, get them working properly, which will go a long way to alleviate low back and sciatica during pregnancy. Then I'm sending my patient home with this stretched for this area, for a particular area for glute medius. So come on up to sitting. If you swing around, Alexis, we'll use, this stretch can be done on the side, I guess at home on the side of a bed is really your best option. So if we're stretching in this case, the left side of the patient, the left leg comes up. Okay. We make like about a 90-degree angle with the knee, like that. We know, if you notice, the patient can have, if you're doing this stretch at home, you can have your leg like that. You can even put it back a little bit, stretch the front of the right hip. And then what you want to do is keep your upright posture, so don't flex forward at the spine, but start to move your chest towards your leg without having the patient's spine deviate off to one side or the other. So they're coming down about in the middle. Now, when you do that stretch, Alexis, where do you feel that?
I would say right down the back through the glutes and into the
On
leg.
your left side, correct?
Yes.
Okay, great. So you guys get a picture of that. So you'd want to do both sides when you do this stretch. Again, you're aiming to feel it in the lower back on that same side, in this case, the left side, and into the glute a little bit. And that, again, will really help open up that area and can give you some relief from sciatica during pregnancy. Okay, come on back up. Perfect. Thanks for watching. I hope this information is useful to you. I hope this can help you with your low back pain and sciatica that you may be suffering with. I'm going to turn it back over to Dr. Walter now.
Wow, that was great, Dr. Pete. Thank you for sharing that with all our viewers. And if you're out there, if you've suffered with sciatica pain during pregnancy, or if you currently have sciatica pain during pregnancy, it may be something you might want to try out either on your own with one of the stretches that Dr. Pete showed, or even that technique that he showed in the glutes with your therapist, chiropractor, massage therapist, or physiotherapist, one of the practitioners that you go see during your pregnancy care. Hope you found that useful. If you did, leave a comment in the comments below. Let me know what you liked about it. Let me know what your experience has been during pregnancy. And again, don't forget to subscribe to this channel. I am going to put out more collaboration videos under this topic of pregnancy and sciatic pain relief. So be sure to subscribe so you don't miss out. This is Dr. Walter, and I'll see you on the next video. To learn more about how corrective chiropractic care at Back to Health Chiropractic Center can help you with your chronic pain problem, visit www.ibthcc.com. Back to Health Chiropractic Center is located at 20 Cranston Park Avenue, number 6, Vaughan, Ontario, L6A2W2.